Ways that we have atropine for the management of myopia is king at this moment in time. Now, is it the only therapy we have? Even though my subject is pharmacological management of myopia, I think it's a complementary therapy to other things. One of the things that I'm doing, and I had the opportunity to talk to Dr. Kemp very briefly. I'm using different dosages of atropine during different types of the year. We know that myopia tends to progress more during the winter time, so I tend to go with a higher concentration during the winter time, lower concentration during the summertime, and also try to get the kid during the summertime outdoor activities. We know that outdoor activities play a fact in myopia control. So even though I am a drug type guy and I like drugs, the reality is that at this moment in time, without much evidence of one mechanism over another, the best thing we can do, and I'm sorry, Dr. Samo, but the best thing we can do before sending the patients to Dr. Samo is trying to avoid a progression of myopia. And that's where you guys come in. And that's why I want to commend the organizing committee. Because now, when you stop looking at this, you guys are way ahead of the curve in talking about myopia control. Now, I probably have another, I'd love to retire tomorrow, but I can't. But I probably have another 10 years of practice. You guys are going to have anywhere between 30 to 40 years of practice. This is something that you guys should be passionate about. This is something that you guys have the ability to run with. So if anything, don't take away that atropine works better than pirenzepine or it's better than hypotensives. Take away that this is a call for you guys to move forward this field with all the tools that you have and all the knowledge that we've acquired. So, in a nutshell, and I'm closing now, recognize that this is a major personal and social problem. Okay? Recognize it's a major opportunity for optometry to grow. And it's a major opportunity for optometry to engage with ophthalmology. We are not seeing this elephant all by ourselves. Everybody's seeing this elephant. Look at interventions to decrease the rate of myopia progression. We need better data. We need new leaders in this field. And that's where you guys come in. So, as I said, I'm only a clinician. I manage myopia. And I want you guys to help me do a better job. Thank you.
Thank you very much, sir. The presentation was just in the nick of time. I would now request Dr. Qasim Jalali to please come and present on retinal nerve fiber layer thickness in myopic respondents.
Thank you. Assalamu alaikum. So my topic here is to discuss about the retinal nerve fiber layer thickness in myopic respondents with the help of spectral domain or CT. So financial disclosure, the author discloses acknowledges and thank Al Ibrahim Eye Hospital administration for their finances towards this research project. So objective of the study was to estimate retinal nerve fiber layer thickness in the myopic respondents using the spectral domain or CT. So here I added some few slides just for the sake of the students. So because I am talking about retinal nerve fiber layer thickness, myopia and spectral domain or CT. So regarding myopia, you can see about various selected countries. It's taken from the Brand-Holder Vision Institute. You can see a 15 to 20 years or even 30 years progression in the rate of myopia. Even you can see US or UK, Hong Kong, where you can see from 27% to even up to the 62% of the myopia progression throughout the 15 to 20 years. And in the second picture, you can see the progression globally regarding the prevalence of myopia in billions, where in 2050, we are expected to have almost half of the population to get myopic by the year 2050. Here is the retinal nerve fiber layer thickness which we evaluated in this study. And third one is the spectral domain OCT. This is just a slide to show you about the generation leap in the OCT as a diagnostic, where earlier there was a time domain and stratus OCT. Now we are having the spectral domain OCT and the Fourier domain OCT, where earlier you can see it as a paraglider or even as a helicopter. It used almost 400 scans, up to 600 scans per second, while now the newest OCTs are having 26,000 A scans per second. So here is about the megapixel. Now the new OCTs are having 2048 pixels at a time, while the earlier OCTs were having just 1 pixel at a time. And the third one, this is just a picture view of the comparison between the OCT time domain stratus OCT and the RTV or Fourier domain OCT. And these are the retinal nerve fiber layer thickness evaluation map which we used. Here you can see 3 colors: red, orange and a green color. After assessing the OCT, an OCT printout gives you 3 types of assessment. If that is coming in the red, you can see that that is the patient is having retinal nerve fiber layer thickness decrease. The second one is the yellow, which shows the borderline thickness, and the third one is the green, which shows a normal retinal nerve fiber layer thickness in the patients. So rationale was myopia is a highly significant problem, not only because of its high prevalence, but also because it can contribute to the visual morbidity and increase the risk of vision-threatening conditions like glaucoma. Methodology was, it was a hospital-based study conducted at Al Ibrahim Eye Hospital in the general male and female OPD, while the investigation department, where we used optical coherence topography. Study duration was May 2018 to October 2018. Sample size was just 40 myopic respondents. Sampling technique was non-probability purposes sampling. Inclusion criteria was patient diagnosed with myopia with only spherical component in mild and moderate degree, and including spherical component of lesser than 1 diopter in high myopia, while age greater than 16 years and less than 14 years were included. Those patients having no previous history of any ocular pathology are patients who are willing to participate and were diagnosed with myopia.